Your heart sounds good. Let me listen to these lungs. Deep breath.
I never have the same day twice. I always have a different day.
Again.
But it's all surrounded with people in my communities. That's my best thing about my job.
Since we are community and we're very hands-on, we're able to fix a problem right where it starts.
This organization, PCHS, or Primary Care Health Services, decided to name our flagship or our headquarters after Alma Illery. We plan to keep that name around throughout our existence.
I trust them with my child because they do really good care with me. So I'll be coming here until the end of time for me.
On a familiar street in Pittsburgh's Homewood neighborhood sits the Alma Illery Health Center, where they've been taking care of people for more than 60 years. Also known as PCHS, or Primary Care Health Services, Alma Illery is the centerpiece of a network of community health centers. Dr. Jerome Gloucester is their president and CEO.
I first arrived here in 1995, and I was a new pediatrician. And I tell the story a lot that I got here and met families, and I walked into a room and one mom asked me, said, "Are you the new pediatrician?" I said, "Yes, I am." And she said, "So how long are you going to be here?" And I remember how that just touched me in a certain kind of way. And we had a great interaction, but I went back to my office and I thought that this is the reason why I'm here. This is the place for me. This community needs physicians that are committed and want to stay here.
That commitment can be traced back to Alma Illery herself, a local civic leader and activist who worked tirelessly to achieve her dream of good health and a fighting chance for local children.
Alma Illery Health Center, or Primary Care Health Services, started first as the Homewood Russian Community Health Center back in the 60s. Other organizations, they're not aware of the history, and we proudly tell them about this community activist, this civil rights activist, this passionate person that fought for children to have summer camps and to have the proper health care. PCHS, or Primary Care Health Services, we have 11 sites throughout the Allegheny County or greater Pittsburgh area, and through those 11 sites, we deliver care to a little over 10,000 patients. That's a conservative estimate. It's probably more like 12,000 patients. I think that one thing that you see with Primary Care Health Services, and honestly probably with most federally qualified health centers, is that we are serving communities and families that are underserved. So they have multiple challenges, multiple things that they're dealing with, whether it's from the standpoint of transportation or standpoint of housing. So I said that story about the mom. That's really, if I'm more expressive of what I experienced when I walked back to my office, I said to myself, God, this is where you want me to be. I know it. You want me to be a place where you're needed, and also, if you will, patients that many others don't want. That's my calling as a Christian.
For those who have joined the team, that commitment often translates to a decades-long relationship at PCHS.
My name is Robin Sims, and I'm a pediatrician, but I'm also the medical director of Primary Care Health Services. I've been here for 25 years, so I'm actually on my second, almost third generation of patients, so that's wonderful. Because we're federally qualified health center, we're mandated no matter what insurance, no matter your ability to pay, we will take care of you. And our patients have a trust. That's what they actually trust us to. And I think it's the longevity and the continuity that you have with your patients.
So I've been coming to Alma Illery for about 8 years now. Well, so my mom actually comes here. She's been going here for years. So Alma Illery's been in our family for a long time. And we actually have Raven. She's been coming here since she was born.
From pediatrics to dentistry to their on-site lab, PCHS Alma Illery covers a wide range of healthcare needs.
I am Lizzie Patton. I'm Director of Pharmacy. I've had the honor of working at Primary Care Health Services for the last 25 years. We not only have the patients from this site, but from our other 8 sites, and we also service all the homeless shelters in the city of Pittsburgh. So we try really hard to be hands-on, walk the person right through all their health care. Because insurance is a barrier, income is a barrier, being able to get a doctor's visit is a barrier, transportation, language. We really attack all that here as someone comes in. We kind of grab you and put a healthcare blanket over you and walk you through the healthcare process. We see about 50 patients a day, and we do about 100 to 150 prescriptions a day. You will not leave here without your medicine. You will not leave here without your medicine. The cost won't matter. The shortages won't matter. You will not leave here without your medicine.
I am the president of the board. In fact, I was the first president of Primary Care Health Services back in 1977. I was fighting down at City Council as a teenager for it to be built. So that was before there was even a building. That was the first Homeward Bruston Neighborhood Health Center. Many of the people that work here is just now starting to change a little bit, but for the longest time, we had a great percentage of our workforce lived in the community, got their services from the community, brought their children to this site, and they themselves were patients. So that commitment grows because of that relationship.
Now, nearly 60 years later, Alma Illery is poised to meet the future with the construction of a new facility.
PCHS is growing and physically growing to now include brand new headquarters. And we're overjoyed with the coming new health center, the ability to have a space that really meets the need.
Along with the improved patient accommodations, the new site will also include an expanded pharmacy, a special sensory room for IDD patients, and an elevator.
What this new building is going to represent is going to be amazing because it's saying that you deserve a high-quality building, a state-of-the-art building, and that our aesthetics also speak to how special you are.
I live here in the community, so I'm able to walk down on a good day or catch a jitney if I need to, but it's right here in the community.
What brings me joy is if I have one person that I've helped that day and they are so grateful for the littlest thing that I did, that brings me joy because it was that little thing that made a difference in their life.
So when we invite people to see this new building, I'm sure there are going to be folks that tell the story as a grandparent as they watch the generations come through, including themselves.
Trust you with their lives and their children's lives, and that's a huge responsibility, and it's also a huge privilege.